Hi guys, it is Monday, July 1st, and I've just arrived back from attending my first ever RIMS conference. RIMS is Rehabilitation in Multiple Sclerosis, and this was held in Hasselt in Belgium. So I'm a clinician, specifically a dietitian. I'm a nutrition researcher, and I'm also a patient living with multiple sclerosis. So it was really interesting to attend a multiple sclerosis conference as a professional, healthcare professional, as a researcher, but also as a patient. So I'm just going to give a little summary about my overview about RIMS, and hopefully it's helpful to some people who are at RIMS or maybe couldn't attend RIMS for whatever reason, whether you're a healthcare professional or a person living with MS. So on Thursday morning we had a tour of the, hope I say this right, the Noorderhart Rehab and MS Centre. This is without doubt the most impressive MS centre I've ever seen in my life. So there was an animal farm with goats, chickens, and many other animals. There was an actual farm then with growing strawberries and other fruits, vegetables such as potatoes and many other varieties of fruit and veg and so on. And there was also an inpatient centre with 120 beds, so people could stay in this MS centre if they were severe enough or if they needed to for several nights or longer if needed. And there was also a day hospital with I think about 10 or 12 beds, where small procedures could be done away from the larger hospital, but in this small centre. There was also an outpatient centre which included fantastic rehabilitation facilities, well kitted out gyms, and so on. For example, there was a private stairwell with a chair at the top, so people with MS could practice climbing stairs, going up and down stairs, and there was a small seat so they could take a seat which came out from the wall, and people could take a seat at the top of the stair if they got tired and have a little rest. There was also about 50 houses on site at this MS centre. Now it wasn't just people with MS, but it was mostly people with MS or something similar like stroke, some other neurological conditions. So these people could live on site right beside this MS rehabilitation centre and obviously get access to services as needed. Some had carers come, but this meant that maybe, let's say, a lady or a gentleman in their 60s or 70s that wasn't able to live at home for whatever reason could live right next to an MS care centre and have kind of 24-hour access to doctors, nurses, MS specialists, physios, OTs, and so on. It's really interesting. All these houses had really wide doors, so they were accessible by wheelchair. The showers were adapted, the toilets were adapted, even the kitchen tops were lowered so that someone in a wheelchair could access facilities much easier. So absolutely phenomenal to see this. This entire MS centre was overseen by I think 3 neurologists, I think 2 rehabilitation physicians. I think there was 3 MS nurses involved as well as psychologists, social workers, lots of physios and occupational therapists, but only 1 dietitian, I think, which was kind of interesting. In the afternoon, we got some presentations, and an interesting one was from Professor Ulrich Dalgas. He presented some data showing that people with MS generally have smaller muscles and lower muscle strength than similar people who did not have MS. This is really interesting, and Professor Dalgas gets extra points because it was sweltering, it was really warm in Hasselt, but he wore shorts during his presentation, and I think I was the only attendee wearing shorts, so everyone else was wearing long trousers, but it was far too warm for me, so extra points for Professor Dalgas. In the question and answer session, I asked Professor Dalgas, was the difference in leg muscle size and strength in people with MS due to MS directly, or due to lack of activity, or something else? And his answer was really assuring for people like me with MS, and hopefully for others with MS. And the answer was really that it was due to decreased activity in people with MS. And he could tell me this because some of their research had actually brought people with MS through a training program and shown that they could increase muscle size and strength and therefore function in people with MS, kind of similar to people who didn't have MS. So really important to see that rehabilitation is so important for people of any stage with MS. On Thursday evening, we had the conference dinner, which was really, really nice to get to meet old connections and new connections. And I got to meet senior physiotherapist and exercise specialist in Ireland, Mary Burke. I'd never met Mary before, and Mary presented a poster, and she works very closely with MS Ireland. So it's fantastic to meet Mary and hear about her work, and hopefully we'll collaborate in the future. Watch this space, Mary. On Friday, we had the official start of the conference, which was opened by the current RIMS president, Giampaolo Briscetto. I hope I pronounced that right, Giampaolo. And he's also the clinical director of the Italian Multiple Sclerosis Society. It was also opened by local organizer, Professor Peter Fez, who's a professor of rehabilitation services and initially a physiotherapist, and did an excellent job in organising the entire conference. So thanks, Peter. And the topic of the entire conference was empowerment and inclusivity. So it was great that the first section of the entire conference included topics such as what is inclusivity, what are the barriers and challenges for inclusivity, and then there was a panel discussion including Inga van de Velde, again I hope I've pronounced that right, who is a patient living with MS for over 20 years I think, and myself and Inga had a couple of chats, and a really nice lady, so really important to have people with MS involved in MS research. In the afternoon, there was some platform presentations, and my favourite was a talk from Denmark titled "Bad Sleep Equals Bad Life. Sleep is clearly associated with quality of life in persons with MS." That was the title of the talk. So as you can see, sleep being very, very important. And this talk opened with a statement that many people with MS experience sleep problems, and the poor sleep is associated with worse MS. So for me, the key questions are, can we improve sleep in people with MS, and how do we do that? And then also, can improving sleep in people with MS actually improve MS symptoms, MS control as well? So we'll have to do a little bit more research in that area. And then the final session of the day focused on digital tools for empowerment and inclusions, with excellent talk from Christopher Hisson, Lorna Paul up in Scotland, and finally from Iris Katharina Penner, who provided some really nice evidence regarding the benefits of mindful meditation for people with MS and overall brain health, I guess, as well. So then on Saturday morning, we had Uzman Khan kick things off with an excellent presentation regarding patient engagement and health policy, research and practice. And Uzman can speak with authority on this because he's a visiting professor of health policy, but he's also a person living with MS, again, for over 20 years, I think. And myself and Uzman were connected previously, but we had never met in person, so it was really nice to meet Uzman. Then Daphne Koss presented data regarding healthcare professional engagement towards a large sample of people with MS, I think over 17,000 people all over Europe. And this large piece of research was supported by the EMSP, which is the European Multiple Sclerosis Platform. And the CEO, Elizabeth, the CEO with the EMSP, provided some updates on other EMSP activities. And I hadn't seen Elizabeth in a number of years. I think the last time I saw Elizabeth was at MS Sessions in Bucharest in 2019. So great to catch up with Elizabeth. And basically this piece of research with over 17,000 people with MS all across Europe found that visible and non-invisible symptoms are very common among those with MS, but satisfaction with symptom management is only moderate across countries. So people aren't fully satisfied with how their symptoms of MS are being managed. And then in terms of healthcare engagement, so thankfully over 99% of people with MS have been seen by a neurologist, and almost 80% are regularly reviewed by their general practitioner, but only 10% of those with MS have been seen by a dietitian like myself. So that was a little bit interesting. And speaking of nutrition is currently not a major focus of the RIMS network, the Rehabilitation and Multiple Sclerosis Network, or the RIMS conference. However, it's great to hear many people mention nutrition in their talks or their posters. And in addition, I got to meet Professor Claudia Merck, who's published many research papers on nutrition, and indeed I was aware of all of this excellent research from Australia. Also, I got to meet with PhD candidate Olivia Wells, who again came all the way from Australia, and then also Dr. Karen Ryman-Lorenz. I hope I pronounced that correctly. And Dr. Lorenz presented a poster regarding nutrition knowledge in people with MS. And together, myself, Claudia, Olivia, and Karen, and a few others spoke about things nutrition related, including nutrition myths in MS and how harmful these can be. For example, causing feelings of guilt and shame, and even thinking that not even eating perfectly could lead to an MS relapse. For example, having a bar of chocolate could lead to having an MS relapse a couple of days later, and that's just not not correct. Then we had a poster session where I got to present my poster. I'm not going to speak about it on this mini video, but if you're interested, I'm going to leave a link below if you'd like to hear what I was speaking about at the RIMS conference. Please check out the link below and you can hear that. And then the final talk of the entire conference was left to Paul Van Ash, who's an expert physiotherapist and the president of Move to Sport. Paul has done fantastic work over the years with many people with MS. For example, bringing a group of people with MS to trek to Machu Picchu in South America, as well as bringing with people with MS to cycle Mont Ventoux, I think that's correct, which is one of the most famous and most difficult mountains in the Tour de France. So pretty impressive work. Thanks, Paul. Some of my own personal takeaways from my first ever RIMS conference include: lifestyle factors are important but still neglected by neurologists and other healthcare professionals working with people with MS, but also these lifestyle factors are sadly neglected by many people living with MS. And these lifestyle factors include physical activity, sleep, tobacco exposure, and nutrition. In fact, one of my favourite slides from the entire conference read: prescribe exercise as early as possible in the disease course to gain maximal benefit, although it's never too late. In other words, the people who work with people with MS should encourage people with MS to exercise, even if they're older or even if they've got more severe disease. But as early as possible is better. So younger is better and earlier on in the disease is better, but it's never too late. So really, really important. But this idea is probably true of other lifestyle factors, whether you have MS or whether you work with people with MS. Prescribe physical activity, better sleep, less tobacco exposure, or none preferably, and better nutrition as early as possible in the disease course to gain maximal benefit. And for me, all of this circles back to the overall theme of the 2024 RIMS conference, which was empowerment. As a healthcare professional and as a researcher, I feel empowered with new connections to global rehabilitation specialists working within the MS field. And as a person myself living with MS, I feel empowered to continue exercising, moving my body, keeping sleep a priority, avoiding tobacco and eating healthy foods to keep my entire body healthy and my MS controlled. Did you attend RIMS? What would you add to my video? If you missed RIMS, let me know what you think of my video. And above all else, I'm going to leave my link so you can connect with me on social media or ask any questions anytime. Other than that, I hope you enjoyed, and I hope to do lots more content regarding MS, my own MS and MS in general, the science, in the near future. Thanks for watching, and please feel free to share this video with anybody who works with people with MS or indeed has MS themselves. Take care.